What would you say about the depth of this vessel for fistula creation? 0.28 centimeters or almost 3 millimeters. It is appropriate. It's less than 5 millimeters. The red and yellow color here indicate turbulence, reverberation artifact, inappropriate scale setting, or stenosis. We're going to call this turbulence. We don't know much about the peak frequencies above or below, so we can't say anything about stenosis. And this is actually the cephalic vein axillary vein junction, where there's an abrupt change in direction, and often a site of stenosis for brachiocephalic or radiocephalic seminal fistulas that have been in place a long time. The diameter of this vessel is appropriate for fistula creation, 0.59 or 6 millimeters. True. The question is, the inflow artery proximal to an AV fistula depicts an abnormal waveform. And the answer again is false. It does show an appropriate waveform for a brachial artery feeding an AV fistula. The depth of this basilic vein is appropriate for fistula creation. We have a cutoff here, but this is a 6. So we're 6 millimeters deep. It's too deep. Should be less than 5 millimeters. The inflow velocity for this brachial artery with an AV fistula beyond is normal, too low, or too high. It's 121 centimeters per second. Number 1, it's too low. Number 2, the waveform is markedly abnormal for an artery feeding an AV fistula. It is a normal triphasic waveform for a native brachial artery, which would lead you to suspect there's occlusion or critical stenosis of the AV fistula.